Hey everybody, it's Reed. I'm back again with our EKG reviews. If you enjoy these, please feel free to subscribe. Let's jump into this. So, pretty good common rhythm here. First thing we're going to do is we're going to look at the forest, and the trees of the forest are our QRSs. And so if I look down at this lead, maybe at the bottom, I see I've got a nice narrow beat, and then I've got funky. And then I've got a nice narrow beat, and I've got a funky beat, narrow, funky. And so you see I've got this narrow, funky, narrow, funky. The funky seems to be coming early every time, right? In between my two normal beats. I would expect the next beat to be coming right here, but these ones are coming a little early. And so let's take a look at our normal beats. Now that we've noted our funky beats, let's take a look at our normal beats and see what we think. They're narrow complex. So that's reassuring. That makes me think that this QRS is coming from somewhere from the AV node, so we might be having a normal rhythm. Let's take a look at what the A tree is doing. If I look up here in lead 1, I see I've got upright P waves in lead 1 in AVF. I've got upright P waves. It tells me that my P wave axis is down to the left, which means I've got a nice sinus P wave. Next thing in the conduction system is my AV node, and I know I can measure AV nodal function with my PR interval. If you look at the PR interval, it is less than 200 milliseconds, so that is a normal PR interval. So no AV blocks. Every P is conducting to its QRS whenever it can. Next thing in our conduction system is the QRS itself. I notice that I've got a narrow QRS that is upright in lead 1. It is upright in AVF, which means that it's going down and to the left, so my axis of my QRS is normal, down and to the left. I can see I've got normal R wave progression throughout the precordium. I don't have any evidence of hypertrophy. So the last thing we'll look for is our ST and T waves. I look for pathological Q waves. I don't know if I see particularly anything in any distribution. You can see some subtle Q waves here in the inferior leads. I'm not going to call those pathological right now. So now let's look at these funky beats. We said they're early, so they are premature. What are they? Premature ventricular contractions, premature atrial contractions. So the first thing I do is I want to look at the morphology of it, and I do see that it's got this wide complex. This is a wide beat, so that increases the likelihood that this is a premature ventricular contraction when it's wide, and the morphology of it really doesn't look like the normal QRSs. But I know the best trick is to look for any atrial activity that occurs before the QRS. And so I look in front of each of these funky beats, and I can scan throughout all the leads, and I can look for any atrial activity, and I do not. The reason why I look for atrial activity is because if I have an early P wave, that P wave can still be conducted through the AV node and potentially be conducted aberrantly throughout the ventricles. So in this case, I do not see any P's, so no ectopic atrial, premature atrial contractions that would drive this. So this is a premature ventricular contraction. We can just confirm that with our other PVCs and just scan through the leads and see no P's, just confirm. So this is another PVC, this funky beat. I don't see any atrial activity, and I scan through multiple leads because I know that not all leads capture atrial activity well. So this is a PVC, right? So we've got this wide complex early beat with no atrial activity before it. It's got to be a premature ventricular contraction. So we've got PVCs, and they're very frequent. They're occurring every second beat, right? We've got normal beat, PVC, normal beat, PVC, normal beat, PVC. So these are premature ventricular contractions in a bigeminal pattern, or ventricular bigeminy. That just tells me that the terminology for every 2 beats we are having ventricular bigeminy. And so what do we ultimately call this? EKG is we've got our sinus rhythm with ventricular bigemmony. So I hope this helps you just kind of go through a comprehensive evaluation of an EKG with frequent PVCs. And yeah, have a great day.